Thanks.
Please have a seat.
Thanks.
Hi Alan,
Yes.
I hope you had comfortable stay here.
Yes, sir.
So Alan, you are from Kerala, Alappuzha.
Yes, sir.
So tell us something about your hometown, home district.
So I was born in Kuttanadu Taluk in the Alappuzha district of Kerala. So the Alappuzha district, so it's actually the smallest district in the state of Kerala, and it also has the largest area of water bodies in the state of Kerala. And the most unique thing about Alappuzha is the presence of the Kuttanadu Taluk, which is unique for its below sea level agricultural farming, sir, including the village from which I hail. Below sea level agricultural farming is done. And Alappuzha, sir, is also known as Venice of the East because of the large number of canal system that passes through the district as well as the unique geography of the city, sir.
Okay. You have mentioned that it has the largest water bodies in Kerala
Yes, in terms of percentage.
in terms of percentage. What are the famous water bodies there?
So the major water body is the Vembanadu Lake itself, sir, which constitutes the majority area. After that, sir, there are multiple rivers. Majorly, four major rivers of Kerala pass through Alappuzha, namely Pampa, Achal Govind, Meenachal, and Manigala. These four rivers drain into the Vembanadu Lakes.
Okay. And regarding the rice cultivation, you have mentioned that it is famous for the below sea level rice farming.
Yes,
We see that, and I see your profile that you have been active in the Punjab region. You have been posted in Punjab region
yes,
as a medical officer.
yes, sir.
Rice cultivation is leading to serious agricultural crisis in Punjab. Can you suggest some lessons that you have learned from Kerala or somewhere else in India which can be implemented in Punjab to tackle the agrarian crisis, particularly related to the declining water tables and the contamination of the water resources?
So specifically to the state of Punjab, sir, if we have to compare it with Kerala, sir, Kuttanadu is also passing through a similar situation, sir. Because Kuttanadu, sir, as such is a water abundant region, and here, sir, the variety that is used is the crop that is suitable to survive in a flood-prone region. So similar technological advancement should be made in the case of Punjab belt also, sir. But here it should be on the contrary, the rice varieties which can survive more in a drought-prone region, where the water requirement is relatively lesser. Such crops can be thought about, sir. Secondly, sir, we need to intensively think about diversifying the crop pattern in a Punjab, sir. Currently, we see that two crops of either rice or wheat, followed by even a third crop of vegetable is also being grown. When I was working in Kannur, I could see that, sir. So this has been leading to depletion of water table. So if we can substitute one of the cereal crop with, let's say, millet or with a vegetable, or we can go for modern farming methods, sir, we might be able to preserve the water table of the area, sir.
Okay. But that also brings us to the issue of the agrarian crisis in general, that you have suggested that we should move to millets. But what are the handicaps? What are the obstacles? Why farmers are finding it increasingly difficult to move to other crops? They are finding it difficult to leave this cycle of wheat and paddy. Because we have been studying about it, we have been disseminating information about it from last at least a decade, but we have not been successful. What are the on-ground problems that we are facing in diversification?
Can I take a few seconds?
Sure.
So, one major factor which I could say was that, sir, there is a certain guarantee that is associated with growing of rice and wheat. The farmers are assured of an income once they grow rice and wheat because they don't have to go in search for a market thanks to the MSP system. However, if they were to diversify to any other crop, there is a challenge in front of the farmers to find a suitable markets. Secondly, sir, there is a great deal of normalization that has been associated with the normal people of the villages, sir, because they find that once everything is going on smoothly for them, because in Punjab the power is also subsidized, they get free power to pump water into the fields. So they think on themselves, why should they make diversify, or why should they think about intensifying capital investments to create new agricultural systems, sir. This normalization on the part of the people is also an issue, sir. Thirdly, sir, our R&D system and the capital investment as such in agriculture has been limited, and these The existing system somewhere suits mostly towards rice and wheat. That's why the people are more prone to growing rice and wheat in these areas.
Okay.
Alan,
Sir,
so are you active on social media?
sir, it would be right to say that I was active on social media, sir. During the preparations, I took a break from social media.
So if you would have been even active on social media at a certain point of time, you must have heard the name of Dr. Liver Doctor. He's a very famous doctor from Kerala. He has done a couple of podcasts and a lot of podcasts and a lot of medical writing as well. So as I can see in your DAP that you have written that your hobby is to read books on Ayurveda and you are a doctor.
Yes, sir.
So a liver doctor from Kerala, he's from Kerala as well. So he often says that Ayurveda is a pseudoscience. Now you are saying on one side that you are doing medical science or you've done medical science and you have also interested in Ayurveda. So how will you nullify his argument when he says that Ayurveda is a pseudoscience and how you can relate Ayurveda to the medical science?
So one major reason that amongst the entire medical fraternity, especially the modern medical practitioners, there is a belief that Ayurveda is a pseudoscience. That is because of lack of knowledge, lack of awareness about the system with medical fraternities. Once we dive deep into these subjects, we might be able to understand better. In my own case, it was during a research that I was doing on psoriasis patients. I came across two of my patients who were simultaneously taking Ayurvedic system of medicine too. And surprisingly, they healed faster than those patients who were taking just the modern medicine system, sir. It was these patients who gave me this interest to read further, sir. And currently, after reading a good number of books, sir, I have understood Ayurveda is not a myth. Actual reason is that, sir, the research and development that happened in Ayurveda is very limited because most of the research publications that happen even today in India or in other parts of the world is from modern medicines. So we cannot scientifically prove the evidence for the treatment practices that are existing in Ayurveda. However, sir, for those systems in which we intensively pursued researches, we were able to prove a correlation that Ayurveda is a scientific practice. A very good example is in the case of Dr. M.S. Velyathan. He himself was a cardiothoracic surgeon practicing in US. He came back to India and he became one of the strongest proponents of Ayurveda in India. He was the director of the special task force that was constituted by the government of India, and he started identifying the constituents of each and every Ayurvedic medicine. And once we started correlating it, sir, we could prove scientific evidence. So maybe, sir, we can conduct more research and more dialogue and exchanges between the doctors.
So you think that it too can be related? It is for the good.
Yes, sir. In my understanding, it's always better to go for an integrative form of medicine. Where, sir, there are certain diseases I do agree where definitely modern medicine have to be good. For example, a patient coming with myocardial infarction, we cannot wait and we have to go for modern medicine. However, there are a good number of chronic diseases, for example, diabetes. Here we have evidences that panchakarma treatment as well as dietary modifications have been able to provide relief to the patient. So there are some diseases where definitely we can think of Ayush system also.
Right. So from Kerala, you have come to Chandigarh, then you went to Punjab. So have you faced any kind of racial discrimination in North when you tell people that you are from South India?
So in my experience, I have never faced any racial discrimination because of me coming from South India. However, sir, while I was working in Khaimar, I did face linguistic barriers, and that was actually due to my own inability to grasp the language Punjabi. Because ultimately, the patients who were coming to me were the villages of Punjab, and they can converse only in Punjabi. And within 1 month, once I was able to understand the language and communicate effectively with them, sir, that barrier was also removed.
So as you said that language is a very big barrier. So in the recent, we have seen that there have been a lot of debates about the three language policy propagated by the new education policy of Indian government. Now from the state of Tamil Nadu, then from the state of Kerala as well, and from Telangana, majorly all the South Indian states, there have been a lot of voices that this three language policy should not be propagated and it is all about Hindi imposition. So if there is a linguistic barrier, can we find some common language between all Indians, or should regional languages be preferred over one unified language?
So in my case, if I was to give an answer to this question, I would definitely prefer Hindi as a third language to be promoted in India, sir. In my own case, I was born in Kerala, I studied in Chandigarh, and later on I worked in Punjab. And the common factor that allowed me to study in Chandigarh, mingle with patients, was that I knew Hindi. Had I not but I was not confident in conversing in Hindi, sir, I could not opt to study in a government medical college in Chandigarh because the seats were available and many other students who had better ranks than me could not opt to study in Chandigarh because of this linguistic barrier. So, in my understanding, since Hindi is language that is spoken amongst the larger population in the country, it is always better to study Hindi. And Kerala state has been a role model for this, sir. Historically, Kerala has been always adopting the three languages, Hindi, English and Malayalam. And we can see that even in the northern parts of the country, a good number of doctors and nurses are from Kerala, are from the state of Kerala. And the advantage definitely has to be that they are well versed in Hindi also.
So, as you said that many or a lot good number of doctors from Kerala are serving in various parts of India, but we have also seen a large outflow of the people of Kerala from India to especially Gulf.
Yes.
And the remittances has been one of the biggest factor in Kerala's GSDP.
Yes.
And as we witnessed in COVID, when remittances declined, so Kerala's economy also suffered.
Yes.
So what are the other parameters that you can think that can help Kerala grow its economy and reduce its dependence on remittances?
Can I take this one, sir? Thank you. Sir, as you rightly said, sir, remittances was a major share of the GSDP of Kerala. And recently we are seeing a different pattern of migration that is towards the European countries and the North American countries, where these migrant populations are, after an initial period of 5 to 10 years, they do not send back the remittances. And we are now about to witness such a decline in the remittances that is coming to the state of Kerala. In that case, sir, we need to think about intensively diversifying the economy, sir. Kerala focused on the agriculture sector and later on in the tertiary sector. Industries could not develop in the state of Kerala. And this is the right time that we think about industrializing the state of Kerala. If large-scale industries cannot take place because of the geographical difficulties, Kerala should try to create higher-level industries. For example, in the semiconductor sector, newer startups are coming. Such initiatives should be encouraged. Secondly, sir, Kerala has a natural advantage of being a major tourism sector state in the country. So, tourism should also be taken into consideration while diversifying. Thirdly, sir, we are planning about Heal in India campaign. And Ayurveda is something that is unique to Kerala's traditions. So, we can think about promoting Ayurvedic medical tourism also for the diversification of Kerala economies.
So as you have spoken so many good things about Kerala, so who gave this title of God's own country to Kerala, and do you think that this title is suitable for Kerala?
So it was actually during the 1990s when Kerala Tourism Department was planning of expanding the tourism presence to other parts of the world. This tagline was actually given by the former Niti Aayog CEO Amitabh Kant, and later on that was popularized by the Kerala Tourism Department. And in my understanding, sir, it rightly suits the state of Kerala. Firstly, sir, the natural scenic beauty of the state of Kerala. It has beaches, hill stations, all within a very small geographical area. Secondly, sir, we can also see a good amount of cultural harmony in the state of Kerala between a diverse number of religions along with the cohabiting in the state. So this cultural harmony can also be a factor that Kerala is also known as the God's own country.
Thank you, sir.
Okay, Alan, so the first thing that is coming to my mind is, since you have served in Punjab as a medical officer, what do you think about the drug problem in Punjab? And what are your solutions that you can propose coming from a medical background? And your option is also medical science?
It's sociology.
It's sociology, wonderful. So thinking about it as a problem, which is a sociological problem, as well as it has some of the things that can be done with the medical background, how can you propose some solutions to the drug problem of Punjab?
Sir, the NGO that I was working was actually an NGO that was tasked with identifying drug addicts. So we were also our primary duty was de-addiction program in Punjab, sir. And in my ground level experience, sir, the issue is very severe. In the Ghanur block, sir, almost every family had at least one drug addict. So the situation is not simple anymore. Sir, with my experience, what I could understand is that we need a multi-pronged approach here. And we need to intensively take part the help of NGOs in pursuing this. Because NGOs like us, we pursued a novel approach. We used to provide free medical camps, establish good rapport with the villages. And once we had that rapport, the villages themselves used to open to us about the drug addicts. And then we started providing them de-addiction treatment. Secondly, sir, from the part of law enforcement agencies, the drug peddlers, they need to be identified and they have to be dealt according to the laws. Thirdly, sir, we need to also provide proper treatment facilities and rehabilitation for the drug addicts. Last year, we identified about 120 drug addicts. However, 30 of them dropped out. And the reason was that after 6 months, once they were almost ready to be reintegrated into society, they could not find any job in the society. People were reluctant to employ them. And here comes the sociological aspect. The society should be willing to re-accept them back into the society. And here we can think about providing them small skills, soft skills, so that they can employ themselves and reintegrate back into society.
And you just mentioned that coming to the law enforcement agencies, they are working on looking at or tapping all the drug peddlers. But do you think drug peddlers are the major problem in Punjab? Or is there somebody, is it like an organized crime? Is there somebody else running the show and then we are putting all the drug peddlers having only 5 grams, 6 grams, 5 grams, 7 grams quantities, they are put into jails? But the real problem still persists. We are fighting with this issue since the last decades now. I think 30, 40 years we have been running after this problem. What exactly is the issue in Punjab? Were you able to understand that?
So the actual issue is that Punjab is a specific place where the demand and supply are coinciding in the single area. From the supply side, sir, being a border area, from the Pakistani, there is a interterritorial trafficking of drugs that is happening. So the supply is rampant, sir. And at the grassroots level, sir, we could witness that Punjab, being a relatively well-off state, sir, the disposable income at the hands of the people is relatively high. So they can afford to buy the drugs. Although there is high unemployment, still the people can afford to buy the drugs. So there is a coincidence of the supply and drugs demand that is coinciding here, sir. And as you rightly said, it's not just the drug peddlers. It's actually an organized crime network. Most of the times we are able to identify only the soft targets, which are the drug peddlers. The higher racket is still persisting, and the recent scheme of the government, the Youth Nashya Bill, that's a very good campaign to pursue to identify the root cause and take them to task.
And since you came from Kerala, then studying in Chandigarh, then working in Punjab, what are the cultural challenges that you faced while you moved from Kerala to Punjab? Can you list down some of the problems that you faced while doing this entire trip?
So one major factor was definitely the food, sir. We used to consume boiled rice in Kerala, and boiled rice was very difficult to be available in Punjab. And the main diet was in village areas we were used to consuming makki ki roti, sarson ka saag, and now I really like that food, sir. Secondly was definitely the linguistic barrier that I faced, sir. Although initially the villages were really helpful, although there were barriers, the people were able to identify my empathy for the patients. So that was also covered. Thirdly, sir, cultural barrier was, I won't call it a barrier, I would say that it was a really interesting opportunity to learn, sir. The dressing culture of Punjab and also a unique tradition where the people bow down in front of their elders and take the blessings. This was something I never saw in the state of Kerala, the respect that is given to elders.
And what is your take on antibiotic resistance, the problem in India?
So definitely the case of antimicrobial resistance is rampantly increasing. To give an example, sir, in the first year of our study, we used to learn that amoxicillin is the first drug of choice in throat infections. By the time I passed out, they said that it is augmentin, amoxicillin plus cloudinic acid, because the bacteria are now resistant to amoxicillin. So within a span of 5.5 years, a unique drug itself was becoming resistant. And this is increasing day by day, sir. And the reasons are also multiple. One is the rampant prescription of antibiotics by the medical, even by the chemist without a proper prescription. Secondly, sir, doctors are also overprescribing, that we have to agree. Thirdly, sir, the antibiotics have been also used in the livestock sector. And these livestock, once they are integrating back into the food chain, they are also creating the issue of antimicrobial resistance in the society.
Why can't the government of India put forward some kind of a program where they can look at all the medical practitioners that they should not subscribe to the broad spectrum antibiotics? Or is the government doing anything to work on this aspect?
Sir, few states have actively taken up initiatives to tackle the antimicrobial resistance. For example, the one I know is the state of Kerala. It has been made very strict that antibiotics cannot be dispensed without the doctor's prescription, and the doctor's prescription has to be also stored by the chemist before dispensing the medicines. At the national level, sir, generally there has been a circular that has been, general protocol has been propagated where broad spectrum antibiotics have been advised to be withheld. However, sir, here comes a major challenge that our infrastructure in the healthcare sector is working with very limited resources. So at the grassroots level, sir, diagnostic tests are not available. For example, if a person comes with urinary infection, we cannot directly pinpoint without proper urine culture test which is the correct strain that is caused. And because of that inability, the doctors at the grassroots level are forced to give the broad spectrum antibiotic. So if we can increase the infrastructure, sir, that would be a greater advantage to pinpoint which strain is actually infecting the patients.
Thank you, Alan.
Thanks.
Okay, Ellen, you have mentioned sociology as your option subject.
Sir.
I would want your take on LGBT plus rights, particularly in light of the developments taking place in US, where the new government, new dispensation, has clearly spoken on the fact that they recognize only two genders.
Sir, here, in my understanding, sir, it is for every liberal society or any progressive society, it is very imperative that we recognize also the third gender. As was recognized in India in the Nalsa case, the third gender was very well recognized and we have integrated them into our systems. And the step that as you mentioned, that the US government going back, I won't say that is very well welcome for any progressive society, especially if that step comes from the United States, which is considered as a superpower in the world, that will show a negative example for all other countries also, sir. And biologically also, sir, in the world, animal kingdom also, there are multiple species who show other practices of sexuality, for example, homosexuality, that's witnessed in multiple species in animal kingdom. So here we have to shun away our attitude that it is something that is against the morality of the society, because it is something very natural and it's only that it is coming to the limelight in the recent ages.
Okay. But don't you think in the recent years the experience has been that the transgender rights have been misutilized to infringe upon the women rights, women domain themselves? The things that women fought for, let's say the women's sports or the separate safe women's spaces, these separate safe women's spaces have been infringed upon on account of the misuse of the LGBT plus rights, particularly transgender rights, and where you can you not just have the third gender, you have 100 other genders as well.
Sir, I do agree that there have been rare instances where such misuses did happen, sir. But if we take it as an umbrella statement and when we go on for not providing the rightful rights of the transgender or the third gender communities, that would not be welcome. We should take all the steps to prevent the misuses by the very small fraction of the population who have been indulging in such activities. And for the rest, sir, we must take all our steps to encourage them to reintegrate with the societies.
Okay, Alan, since you have suggested, I would want you to make some suggestions. How can we prevent the misuse of these rights? Given the new age dynamics and everything, how can we prevent the misuse of the transgender rights or LGBT plus rights?
Can you please clarify in cases of, for example, transgender misusing the rights to?
Yes, you mentioned that we have to take certain safeguards through which the misuse can be prevented. So what are those safeguards? What can be those safeguards?
Can I take few seconds, sir?
Sure.
Thanks. So one thing, sir, if we are speaking about some events, let's say sports events, here when an athlete is to be attended, to be given the registration, sir, now the technology has advanced, we can go for studies like hormonal diagnosis, which will state very clearly that the person belongs to which gender. So here we can prevent a misuse, sir. Secondly, sir, it is very high time that we issue to the transgender community a national identity card on parlance with the national health ID, so that they can get all the benefits also linked to them. So it will not just prevent misuse of their rights, but also ensure that their rights are delivered to the national transgender community also.
Thank you, Alan.
Thank you, sir.
That's all.
Yes.
बताओ सर। Now, the general, आपके like I have been observing what answers you have been given to me as well as to the other panel members, and overall your diction has been good, your English expression has been very good. Body language, your eye contact was good. You were maintaining contact largely, like 80% with the one who is asking the question and 20% with the other panel members. That was perfect. You were confident in your body language. Your face expression was pleasant. But as the interview went on, well, it was I guess we took almost 30 minutes. 30 minutes. So it was a long interview. As the interview went on, I observed that your face movement increased. This movement, not the eye contact movement. The face, while you are just like you are speaking to me and you are moving too much of your face, and your eyebrows have started moving. So as the movie, like after 15 minutes, your movements started happening. The hand movement also. Your right hand, you were like in first 15 minutes it was minutes it was stable.
We are supposed to keep still or the moment is
Yeah, like it seemed as if something has changed. Like what was bothering me initially, you were like very stable. But after 15 minutes, it was like your face movement has increased, your eyebrow movement has increased, your hand movement has started happening. So I could see that difference. The first 15 minutes went differently and last 15 minutes went differently. So your interview may, like, it can go on for 30 minutes, it is very common. So there shouldn't be this demarcation, change, like you have changed, like you are feeling the pressure. It is just conveying me as if you have started taking pressure after a certain while. So, first 15 minutes it was perfect as far as the body language part was concerned. Regarding your background, both with respect to your state and with respect to your educational background, being a doctor, all those questions were very well handled, I guess. Sir ne bhi puche. So, microbial resistance wala, Ayurveda wala, all the questions, I guess, were very well addressed. Optional wala, last wala ya jo maine tumse pucha, like, are you comfortable in Hindi?
Yes.
And anyways, answer in English only. I thought that your view, I have not taken their view, but I feel that your view was one-sided view. That you were very rigid on that part of
the
transgender wala. I asked you for the suggestions, what safeguards can be taken. You said the solutions that you presented, they were not coherent and they are not workable given your medical background. All that today I need to do in compete in women's sport is claim that I am a woman and take hormonal pill for 1 year. After that, your test will not work because I will have taken that hormonal pill for 1 year. My test will show that I am a woman and I will claim that I am. No one can break the female swimming record because it is made by a male. The safeguards part was good, but it seemed that you have not prepared that topic.
Yes, I am.
Because it is like your optional is sociology, you have to be very well versed in that. It could work with any other person, but not with the one with the sociology background. And that part has to be very well addressed. What suggestions can be done, what safeguards can be taken, and how you have to present both sides of the picture.
Yes,
That, but your answer was more tilting towards like favoring the repercussions of wide misuse of the LGBT plus rights has not been pressed upon by you.
You were trying to be politically correct.
Yeah.
It's good. ये होना चाहिए because we wanted to present that it is a progressive society and you are a progressive man. We don't judge you for that you are a progressive mind or not. We are judging you on the basis of your answer. So you don't need to be politically correct. You need to be accurate in your answer.
Current developments, your language issue, like you handled it very well. The Kerala remittance issue you handled very well. Diversification knowledge, the economy diversification knowledge, the suggestions that you gave, all were like to the point. Regarding the agricultural questions, I feel that in the beginning that the questions that I asked, not that anything you said was wrong, but I felt that you were just like making up English statements related to agriculture.
It could have been more in depth.
It did not.
The problems you were telling were very generic. Because sir was asking you about the suggestions that what can be done, how it can be. So you were telling the basic problems. Okay, we are expecting a bit more from you.
Okay, like everything as a civil servant, like whatever solutions you were asked to give, be it on de-adduction, be it on like the microbial resistance, they were spot on. And in general, I found that when a question is asked, in general you have a solution-centric approach, but for the agriculture wale questions. So that's all.
Sir, एक छोटा सा जो what you talked about, just sir asked a question about the transgender issue. So you talked about national identity card should be given to the transgenders. Now you have a sociology background. You have understood sociology, you have read sociology, you have cracked your beans. So now you need to understand that sociologically, that idea of transgender identification is problematic in a society like India. Because transgenders are not socially acceptable in India. So if you are issuing a transgender a national identity card, that wherever they are going, they are carrying a card that I am a transgender. So in an already segregated, excluded society, you are giving them one more chance to be excluded. So that answer of that solution is not accurate. It may be a bureaucratic solution that may be heard because that, but it's still not a progressive solution or accurate solution, right? One thing. Secondly, what sir talked about body movement. So your hand movement, little bit is fine. Okay, but what was sir talking about your eyebrows and everything? That there were a couple of questions which I felt you were uncomfortable in answering.
Yeah.
Where you took a couple of minutes that can I take a minute or so to answer. So at that point of time, it seemed that you were nervous. You were a bit nervous because you have to think. So even if you are thinking, it should not be presented in a manner that you are nervous. है ना, जैसे सर ने सवाल पूछा, एक सर ने क्वेश्चन पूछा था that in which you took a couple of minutes to think. So at that point of time, वो चेंज आया था बिहेवियर में. ठीक है, वो नहीं आना चाहिए. अब 10 सेकंड लो, 15 सेकंड लो, पर आपका बिहेवियर ऐसा चेंज नहीं होना चाहिए कि ऐसा अगले को फील हो कि हाँ यार ये फंस गया, है ना. तो क्योंकि आप तेज जवाब देने के चक्कर में कई बार क्या होता है, वर्ड्स ऊपर नीचे हो जाते हैं, है ना. तो वो पता लग जाता है यार ये फंस गया इस क्वेश्चन में. सो वी कैन आस्क कपल ऑफ मोर क्वेश्चंस ऑन दिस पर्टिकुलर इशू, ये तो फंस चुका है इस क्वेश्चन, है ना. दैट कैन बी रेक्टिफाइड. उसके अलावा जो आइटम गॉड्स ओन कंट्री वाला, वो अमिताभ कांत सर ने तो उसको इंप्लीमेंट करा था. दैट वाज गिवन बाय सम एडवर्टाइजर, ठीक है, मार्टिन और समथिंग, आई फॉरगॉट द नेम ऑफ दैट एडवर्टाइजर. सो गो एंड चेक दैट हु गेव दैट टाइटल. ओरिजिनल टाइटल वाज केरला वाज गिवन बाय सम एडवर्टाइजर, ठीक है. क्योंकि जब केरला टूरिज्म डिपार्टमेंट ने बोला कि यार हमने ऐसा एक कोई प्लान बनाना है कि लोग केरल को देखने आए, तो जो एडवर्टाइजर था जिनको काम दिया गया था उन्होंने टाइटल दिया था गॉड्स ओन कंट्री. अमिताभ कांत सर जो थे वो उसके एग्जीक्यूटिव, ठीक है. तो उसको रेक्टिफाई करो थोड़ा सा. बाकी तो आई थिंक इट वाज फाइन.
Overall, तो Alan, most of the points have been taken care of, but I think overall the personality is very pleasing, and your etiquettes, whatever your dressing sense, everything looks perfect. Only thing is, I don't know if both of the other panelists noticed that somewhere when you were a bit nervous, your eyeballs could very easily tell us that you seem to be a little nervous. That is, I think, somewhere you will have to take note of that and just control how you can control your expression at that point. Yes. So that whether, see, it is natural to be nervous, right? But it does not have to come across the table. Right? Yes. It has to stay with you. So I think that is one aspect that you can work on. Otherwise, sociology, we are not able to touch a lot of things on sociology because I asked, both the panelists had already asked, so I'm not able to talk about sociology, a lot of things. But I think you must be prepare sociology very well because a lot of questions will be floating around your optional subject. So all aspects, like some of the questions were related to sociology, but I would request you to again go back, check what is happening in the country at this point, what is happening in Kerala, all the sociology related
and the controversial questions.
Yes,
like sociology is a controversial subject.
Exactly. So you have to take stand, and whenever you have to take a stand, then you sociologically it cannot be incorrect since you come from that optional subject. That is it from my side.
Thank you, Alan. Take this feedback if you want.
Thank you, Alan.
Thank you, Alan.
Best wishes.
आज के टेनिस बटन अप करके खोलना मैंडेटरी या फिर खोल के आ सकते हो?
ऐसा there is no rule.
बाय चांस अगर बटन स्टक हो गया तो शुरुआत में ही अनकंफर्टेबल
वो थोड़ा बटन अप जो होता है थोड़ा अच्छा लगता है, ठीक है ना. ये थोड़ा सा इनफॉर्मल लगता है, थोड़ा सा फॉर्मल एक ग्रेसफुल एलिगेंट लुक देता है, ठीक है. तो रादर देन वो ऊपर वाला बटन का एक अंदर बटन होता है, वो लगा लो, वो थोड़ा आपको कंफर्टेबल लुक देगा. वो इट इज इजी टू ओपन, ठीक है. क्योंकि ना कि जब बटन आप आगे वाला बटन लगाते हो तो आपका कोट टाइट हो जाता है. वो जो अंदर वाला बटन होता है वो थोड़ा लूजन अप करने के लिए होता है, तो उसको लगा लो, खोल लोगे इट विल बी इजी. तो अंदर जो बटन होगा वो दैट विल बी हेल्पफुल.
Also, ये जो साइड में आपके आंख पे लगा है, you have to remove that.
ये ब्रांड एंडोर्समेंट जो आपने करी है.
ठीक है. Thank you.
Thank you, Alan. Thank you so much. you.